Yeah, Juliet wants to do a speaking session. Okay, Juliet, you can definitely do next. Yeah, Juliet wants to do a speaking session. Okay. Yeah. So, yes. So, Farzana Khan, you can start now.
Good afternoon, Miss Tanya.
Good afternoon, nurse.
My name is Farzana. I am one of registered nurses working in this accident and emergency department. So, Tanya, how are you feeling now?
Yeah, I am fine, nurse, but the thing is, I am not able to do anything because of this headache. It's intense, it's severe throbbing headache, especially on the right side of the forehead. I don't know what type of headache it is, only one side I get, and it's giving me a lot of tension. I'm not able to do anything. It's totally made my world upside down.
Okay, Tanya, I'm sorry to hear that you're going through such this problem. So, Tanya, I would like to ask you more history about your current condition. Would you mind telling me?
Yes, of course.
Tanya,
I
I would like to ask.
yeah, go ahead.
Yes, Tanya, I would like to ask you that how long have you been experiencing this problem?
Yeah, it has been for quite some days, but today
Mhm.
it is very severe. It's unbearable.
Okay. Once again, I'm sorry to hear that, Miss Tanya. And have you experienced anything which has triggered your headache?
Um, this work, it's taking my mind fully, and I'm totally involved in this work, and it's I'm not able to. Yeah, it's very stressful job.
All right. And also, could you please rate your severity of your headache? Like 0 for no pain and 10 is the severe pain.
I don't know what rating I can give, but it is beyond measure. Maybe 10 out of 10 or 9 out of 10, it may be, I think.
Okay, Tanya, thank you for telling all the details. And also, I would like to ask you about your nature of work. Could you please elaborate me for better understanding?
I am a business personnel, and I'm going to attend a major business meeting. And yeah, I participate with delegates and I involve in serious decision making and managing and organizing, regularizing everything related to business.
All right, Tanya, thank you for telling me all the details. So, Tanya, have you tried any medication before?
Um, Not exactly, but I try to just relax for some time and afterwards continue like that. But yeah, this time I'm not able to do that.
Okay, Tanya, and do you have any other health condition apart from this headache?
No, nurse, nothing like that.
Oh, okay, once again, thank you so much, Tanya, that sharing your all details. According to your symptoms, I can diagnose the possibility of a migraine, which is probably triggered by the stress. As you told me that you're a very busy person. So yeah, but I can assure you that the appropriate diagnosis will tell you the doctor after your assessment. So I hope I'm clear to you now, Tanya.
Yeah, that's of course. Now, what should I do at present? I have
Yes.
to. I'm getting back to work, and I have to do something. I want something immediate relief.
Yes, Tanya, I totally understand your concern. Uh, for that, Could you please wait for 30 minutes? That doctor is busy with the other patient. Once he is free, definitely he will come and see you and give you the appropriate treatment. So, is that okay with you?
I don't think I can wait for 30 minutes because I have a business meeting in 20 minutes and I have to go. Why
Mhm.
don't you give me some immediate relief, pain relief, so that I can temporarily be subsided? The problem can be
Yes,
subsided.
Tanya. Yes, Tanya, I acknowledge your concern and I appreciate your caution, but I'm not the authorized person to give you any pain medication. But yeah, I will definitely tell your symptoms to the doctor and he will come to see you soon and he will give you the proper treatment. As you know, that doctor is, this is a accident and emergency department. At present, doctor is busy with a critical patient. So yeah, definitely he will come soon and see you. Till the time, could you please wait here? If
Um,
yeah.
yeah, my condition is also emergency, so I'll be happy if you can treat me on an emergency basis and let me not wait for 30 minutes, as you said. So try to do as early as possible.
Yes, Tanya, definitely will provide you the best and immediate treatment. As I told you that a doctor is busy with the very life-threatening patient, and till the time, can I provide you some coffee, a cup of coffee or ice pack, so that will be helpful for your migraine. How does it sound, Tanya?
Okay, fine, nurse. Whatever it pleases you. I have no other option. I have to wait. Okay, try to do as early as possible.
Yes, Tanya, thank you. And I am glad that you are following my instructions. And yeah, uh, could you please wait here and doctor will come and he will explain you and he will evaluate your condition and definitely he will provide you appropriate treatment. Till the time, I would like to provide you some leaflet. You go through it. There is mentioned do's and don'ts. That you will have some ideas about your current condition. And I am around here. If you need any help, please call me. I will come here to help you. Thank
O-
you and have a good day.
Okay, nurse, that's definitely fine. And I'm very much pleased with your suggestions. Thank you once again.
Thank you. Have a good day.
Yeah, so that's the speaking. And now let me give you some feedback. Yeah. Um, yeah. So now coming to the point, um, Farzana Khan. Yeah, you are speaking very smoothly. I really appreciate the way how you are minting the words. Okay. You're not at all mincing the words, you're minting the words. Word after word after word, as if, a sparrow or an eagle dives from the sky to the ground to grab a rat or something else. Its prey, just gliding the words through. Really pleased with your way, okay? The way how you are doing. I really appreciate, okay? I have no words for that. But the thing is, you have to focus a little more. You have to focus a little more on how to improve. You're managing the role play perfectly well. There's no doubt regarding 100%. You're managing little better than many others. I can tell you. Your speaking is definitely B plus, not B. B plus means something like 400. It's not just 350. It's almost close. About 400 or a little above 410. You're doing well. You can improve the way, the level, the tone, the confidence, the style, the presentation. Everything is pretty awesome. I can tell you. I'm not just appreciating you. It's not buttering you, but to tell you the fact. Yeah, the flow is perfectly smooth. Smooth. running we call smooth drive. Yeah, smooth drive, well done. But now that's okay. But what about level 3? That's called quality enhancement. How more, how better you get perform. Okay, your previous sessions. Yeah, I'm going to focus on that one now. I'm going to focus on that one now. Right. So, the question, the question, right. Wait for 30 minutes to see one of the doctors. The patient is angry. She has come to the emergency department because she has emergency. And still you ask her to wait for 30 minutes. That doesn't sound fine. How can you tell her to wait for another 30 minutes? It's an emergency department, right? Just saying 30 minutes wait is not very okay with anybody. That should be accident and emergency department. You should attend as immediately as possible. Okay, as early as possible. That's the logic behind accident and emergency department. Okay, now let us discuss this particular point here. How I will tell if I am the nurse, how I am going to respond. Rasha Hafiz, very good. Rasha Hafiz. Yeah, we can do the next speaking if you can. Right, you can message me if you want a speaking session. You can message me, Rasha Hafiz, on my WhatsApp. Yeah. So, if I am a patient, sorry, I am a nurse, how I am going to speak? Yeah, I am one of the nurses in this accident and emergency ward. After listening to your concerns, I can understand the urgency of your situation. More than your headache, you're bothered about your next meeting. For us, your health is fundamental priority, but for you, your meeting, attending the meeting is the obligation. I understand. I understand. Your concentration, your focus, your attention is more on your attending the meeting. For us, that is secondary. Your health is primary. Of course, this is accident and emergency department. The doctors are very busy attending an emergency case, a very serious case. There is an accident in the morning with severe injuries, and the doctors are there attending 3 or 4 patients. And it's really a life and death situation. You have to create, and that's the fact. No? Otherwise, why will you ask him to wait for 30 minutes? Try to understand the logic behind the question. Read between the lines. You're asking the patient to wait because the doctors are busy. Busy with what? With the cases. Cases more serious than mine or what? So you have to build up that plot, construction, we call it. You have a headache. Definitely. It's very serious. I can understand. And it's urgency. You already told me. because you have to attend a meeting immediately in 20 minutes time. But here is the question: this condition, this emergency cannot wait. It's topmost priority, because if neglected, the complications, the consequences may be devastating or may even lead to death. So, such is this situation. And the doctors are busy attending those accident victims. Please do understand the grave situation. The doctors are not in a position to come and attend you immediately. Try to put yourself into the feet of the patients who are suffering and try to comprehend the situation. The doctors are busy handling those patients. Please relax. I hope you understand the gravity of the situation. It is humanly impossible for the doctors to come, leaving the patients to fend for themselves and to treat you immediately. But believe me, I'll just go back, check it out, and once the doctor is free, immediately I'll put your words through into the ears of the doctor and then get him to see you. So please be patient. We are at your service. Your concern is very important for us. Your concern is very important for us. Fine. I hope you'll understand the situation and wait for a few minutes. Maximum time may be 30 minutes. But trust me, if the doctor is free in 10 minutes or 15 minutes at the earliest, I'll get him to see you. I beg your pardon for this delay, but it is beyond human reason. So you think of how best you can present. Okay, how best you can present. If possible, you can delay the meeting on the meeting to the next day or start a little later or let the meeting be continued with your assistant or somebody else. And regarding pain medication, regarding pain medication, okay, regarding pain medication. I am not the authorized personnel to provide you some pain relief immediately. I am a nurse by profession, and the doctor has to provide you with the medication. But only after visiting you personally and discussing your problems and diagnosing your then only then he will provide you the medication. I hope you understand. It is in the best interest of your health that I suggest you to wait. Thank you for listening to my words and accepting and your acceptance. Okay. So, yeah. So you can get a permanent solution. It's not a temporary. Okay. This is an ongoing problem. Yeah. It's an ongoing problem. But you need a permanent solution for that, right? Not a temporary solution. So if you see the doctor, discuss all your concerns, share all your symptoms. The doctor will give you the best possible treatment. So, how you want to explain? Consider that as sympathy, that belongingness, that affection, that feelings of love and caring and sharing. These are very, very important, right? Yeah, Farzana.
Yes, sir.
Yeah, do you have anything to say?
No, sir. Thank you so much.
What, sir? How much well I perform? Na? How much I perform? Still, you tell something. Na? You don't find any faults, but still you tell something. Correct? What do I do? You come to me only to learn, right? Not just to say, okay, very good, and leave. So, yeah, share your feelings, share your what you learned and how it was useful for you. Discuss all whatever you want.
Yeah, it was good, sir. I know what to improve in my speaking. Now I get that point. Thank you so much, Simon, sir.
Yeah, welcome, welcome. That's very good. Okay, so